Thai massage workbooks and videos that I've put out, I'm always trying to refine the information that I give therapists. One of the things about the workbooks is it's a little more difficult to demonstrate movement. And when I work on people, I tend to use a lot of jostling and rocking. So when I'm working on someone either on a table or on a mat, I may come in and work the sin lines from Thai massage, but I include some gentle rocking along with it. And I wanted to demonstrate just a simple technique that I use. I'll often come in and making contact. I may be finger pressing or thumb pad pressing along this upper line on the outside of the leg. The receiver doesn't know what I'm doing. I'm just coming along and rocking them. This just feels good to their leg. Let's skip over the knee. And you'll notice as I do this, Andrea's foot is moving the most, but it's also starting to access deeply into her hips and lumbar spine, and even up to her neck. This is extremely gentle for me. Doesn't take a lot of hand work. It's not a lot of pressure on my carpals, but the receiver starts to let go because in a sense you've tricked them into relaxing. Even though I'm pressing on her leg and using this gentle thumbing along the line, she's starting to let her upper back and neck go. It's a simple, effective way to work on someone. You can also get both arms involved or switch to the other side. It's an easy way to say hello to a client, to start engaging with tissue. I'm using the arms to try to access into the upper back, usually trapezius, the rhomboids, also into the neck. I'll often interlace fingers with the receiver. I've got a good grip here. And with their elbow bent, I'm able to shake their arm out. I'll often come in grabbing across the wrist and forearm. There's a little traction. You can see Andrea's head and neck move as I traction her down. There's a little pull through the sin lines that go out the hand and palm. Helps the receiver let go. I'll usually traction them different directions. You can just mobilize. You're feeling for muscle tension. Then up above. And if I'd like, sometimes come across the body. Same thing. You can interlace if you'd like. And a little pull. Rhomboids, trapezius are stretched. If you need to, you can lean in with your hips along the table to stabilize if you're working on a table. Little pull. She's letting her neck go even though I'm using her hand and arm as the lever. I'll come around again and finish just like I started. Simple, easy. When I work with massage therapists, many complain about their hands and carpals because of excess use. You have all of these tiny muscles and smaller areas to deliver pressure. So as I'm leaning in, there's pressure on these joints. You're using tiny muscles to stabilize and work. These areas become overworked. Therapists will sometimes have pain. So I'm a bit of a stickler about body mechanics, specifically for the hands. What I will see is massage therapists are doing things to the wrist like this, where they're putting pressure and they're bending at the wrist where they're creating a crease. In the short term, this isn't a big deal. If you do this 6 hours a day, weeks on weeks, most people will start to develop some issues. What I tend to do is get massage therapists to lessen the angle that they're using for pressure. So instead of coming in and down, I have them go out, and you can see that there's less of a crease here. This is more effective body mechanics and leverage. I'm leaning with my knees and hips. I'm starting to lean from hara. There's even a little bit of glide. I'm not using any cream or lotion, but there's enough oil on Andrea's arm, just natural oils from her skin to be able to glide. This is a better body position and wrist position for my hand. The same things happen in downward facing dog pose and yoga. Is trying to get people, instead of completely flattening the hand, is to have a bit of an arch. There's a little bit of play. And my palm is able to see it contract and relax as I go along to find a better position for my carpals, my wrists, the radius, the ulna, that works for me. This is isometric. It means that it's held, and it allows me to slide and glide easily with less strain on my hands. So when I talk to massage therapists about hand mechanics, we're not just dealing with the wrist, we're also specifically dealing with the thumb. Massage therapists tend to lean very heavily into the thumbs, and I see a lot of this. They bend the thumb joint and they start to experience discomfort at this joint. This is a bit of a hyperextension. You can see that my thumb just naturally does this. I don't want to use this for my body mechanics doing massage on people. What I want to be able to do is gain enough strength in, was it opponent's pollicis, that I can support and press the thumb down. You can see this muscle bulge, but you'll see that what I've done is I've used the muscular strength to support the thumb. So as I'm leaning in, I'm able to maintain the joint. It's a more effective use of body mechanics for the thumb itself. It means that my hand, eventually what will happen is my muscles will get tired. Over time, you will develop more muscular strength, and what you're doing is, instead of leaning through the ligaments and compromising the joint, you're actually using the muscles to strengthen, to stabilize, so that you can keep working. I recently released the table tie workbook that I wrote, and in all honesty, it was almost like pulling teeth to get me to a point in my career where I could write the workbook. I prefer mat work. I've had 10 years experience working on a mat. I prefer the leverage and body mechanics that comes from being able to use my legs and feet. I don't think that table tie is inadequate. I simply think that it pales in comparison to what massage therapists are capable of using mat work. When you're dealing with different body mechanics, table work is leaning more through the arms, through the chest, and massage therapists have a tendency to slouch, something that mat work seems to take out of the equation. When I'm working on someone and using simple techniques like what I call the tree pose, when I improvise these for the table, what I wind up doing is helping the receiver go into what looks like a reclined tree, and I have to slightly change the body mechanics. Usually in a mat session, I would be up at her level, leaning down. Now I have to come to the side and press the leg gently down to open the adductors and leg. You can see the angle of my hands, what's going on with my body. Mat work will allow a massage therapist to have more depth and pressure using their full body weight as opposed to just their arms and upper body. And if I switch to the other side, same thing. It's not that table tie isn't good. Table tie is still completely fantastic and will help you save your hands. You can see that I've lifted up onto the balls of my feet. I'm lifting my body up to try to get leverage. If I was doing mat work, I would be completely above, just leaning down. It means that I'm using lean instead of muscular effort. The table tie workbook is available on my website at robertgardnerwellness.com. We made it extremely affordable for massage therapists who need help in their practice. And tree pose works on the adductors, works on the inner sin line and the legs. Many massage therapists will ask me about getting up on the massage table to do table tie. I included a section in the table tie workbook that includes getting on the table and putting full body weight on the table is possible, but I would tell you to exercise extreme caution. I included it at the end of the workbook for a reason. There are many options where you can sort of get half on the table that are a little bit safer. And I wanted to show you one for the lumbar spine and psoas. I'll have the receiver's leg go into what I call a kickstand. Their foot is solidly on the table. Usually in a mat session, I would kneel on either side of the knees. You'll see that in the intro tie workbook that I wrote. But for a table session, what I will do is come in and lean. So now I'm sitting comfortably. My thigh is on top of Andrea's foot. So I'm stabilizing and anchoring her foot. Then I'm going to come underneath the knee, and with a good solid grip, I start to lean. What I'm doing is pulling her femur, trying to access her low back. You can see that for me, if I allow my body to move, I can stretch and lengthen my own arms. It gives me a chance to stretch while I work on her. And there's just a gentle kneading and rocking along the sacrum. So, Andrea's clothed. If I were doing a table session where she was draped, I would just do this on top of the sheet. Anything along the sacrum that is fleshy, totally fine to work. Receivers love having this. As a massage therapist, you nearly have to include gluteal work to do an effective session. You're missing such a huge muscular group, and gluteal tension contributes so much to low back pain. If you leave this out, the session's half done. So as you can see, my fingers are just folded in, just a gentle knead. I'll switch to the opposite side. Sometimes I'll add in this palm press along the spine. I think even just subtle techniques like this, it has the receiver know that we're working on their body, makes them feel comfortable, secure, and it just feels good. Anywhere that's fleshy, just don't press into the tailbone, but any of the muscular attachments along the sacrum, gluteus maximus, medius minimus, then you get to the deep lateral rotators and piriformis, all extremely effective. The pressure down into my hands. You can get the table tie workbook at robertgardnerwellness.com.